I will assign somebody to be the first one. So.
Kathy, if we've got our slides, I think we could probably go first. If you're able to share the screen on the slide.
Yeah, I could do that.
Okay, perfect. Well, let's do Watersheds and Health first. So Kathy, you can share your slide, and then the person who is designated to speak to the points, let's hear.
So go ahead, Shannon. Yes, great.
So yeah, we just had a really interesting discussion, and a couple points we wanted to bring up is really the importance of challenging ownership in land and water for work in watersheds. I think somewhat in and along that lines is also to recognize that while the DRIPA Act is a great opportunity, it is also still a piece of Western legislation. It was talked about how we move conversations such as this, you know, outside of PHS, you know, these discussions here today, and that there needs to be influence on at many tables, including amongst decision makers, to reflect the holistic approach in public health. So we can have these conversations and everyone agree, but then if it gets to a certain point where a decision is made and that isn't valued at the decision-making table, it doesn't really go any further. That Watersheds and Health is beyond environmental health practice. And so sometimes people who aren't involved in environmental health per se don't feel that maybe they have a role in watershed health, but it's beyond that. And so it touches on all aspects of public health, including equity, ecology, Indigenous issues. And there's a whole body of professionals behind environmental public health work. You know, having the DRIPA creates the foundation for more integrative conversations. It was talked about that sometimes people may personally have done work and have this approach, but now it's it feels empowering to have, you know, a session at PHAVC talking about, you know, approaches to environment and health, and also the DRIPA being something that lends more strength to these kinds of arguments. We talked about grounding health promotion in the living systems we depend on. So Trevor touched a bit on that this morning, that was originally part of the approach, but had been somewhat pushed off along the way. And that's really how, you know, in the last point here, you know, we forget land and water systems often within public health. So yeah, that's what we talked about around our, I guess, virtual table.
It was a great discussion, and I just felt really glad that with the people saying how glad they were to have this conversation in a PHABC event. So yeah, thanks everybody for a really neat discussion.
Awesome. Well, that sounds like you guys did have an excellent discussion. I can't wait to see the recordings of it, and I'm sure everybody else will be very excited to check it out too. So I'm going to pass it off to the Sustainability of AgriFood Systems group.
Great, thanks, Christina. Thank you, Craig, for pulling that up. So we had a very rich discussion around a wide variety of topics, as many had others, and I want to acknowledge that there are some interconnections with the previous group around watersheds and lands and the importance of centering land systems and water systems with food production and agriculture. One of our major points of discussion was around ideological camps that have arisen between the corporatization of agriculture and the host of food system effects that have arisen from that, while a simultaneous movement has sprung up around agroecological practices, around place-based food systems, and that there's a real gap between those two groups. And when we think about the implications for food security, having multiple conversations, being able to convene those conversations was a major point of consideration, and that public health has a strong role to play in advancing the linkages between agri-food systems and health and well-being. And so we look forward to more intervention and convening being done through the health sector into the agricultural sector. This kind of leads to our second point, where agriculture has implications in public health that connects across not just the city, but also across land and environment, and that this space for having these conversations across so much diversity presents an opportunity for other models, for other areas to engage and to intervene. We talked again about the connection between planetary health of people and planet, the importance of food moving beyond food security to include cultural and other health dimensions, that people build their identities, they build their communities around food, they build their connections to land and waters through food. It isn't strictly a commodity, it exists beyond a commodified space. And this brings us to considerations around food sovereignty as a core public health function, conversations that we had around self-determination, and that COVID has brought the opportunity to raise action to the next level, with public health having a strong role there. And finally, the need to consider other food systems, so not just Western approaches to food and food production, but indigenous food lands and waters, hunting, foraging, and exploring those kinds of practices. Does anyone else from our breakout room want to add anything? Did I cover it? Okay.
Well,
Great.
that's great. That's excellent. You guys had another great conversation. This is so great to hear everything. So we're going to pass it off to, let's go with utilizing a One Health approach in the context of a pandemic. What did you guys talk about?
Okay, sorry, let me just share my screen here.
Perfect.
All right, can people see the slide? Sorry, I'm just going to zoom in.
Looks good, yep.
Perfect. So we also had a really interesting discussion, I would say closely linked to the sustainability of the agri-food systems. Dr. Clow gave a really great overview of One Health as a concept and One Health as an approach. Really, when we started talking about the role of public health and how we work this into pandemic preparedness and prevention, we jumped quickly to the prevention side. And there was a lot of discussion around how do we incorporate interspecies justice into policy and practice. And so a big emphasis on how do we shift this concept of hierarchy where humans go over the environment, go over animals, and take that to more of an equitable approach to all aspects. And the reason this links back to the pandemic as part of the discussion was the role of deforestation and industrialization of agriculture, bringing wildlife into increasingly closer contact with domestic animals, and our desire generally for cheap food, without respecting the health and welfare of the environment and animals. How this results in actually a really complex interplay of factors that bring about something like COVID-19. So as public health professionals, we talked a little bit about how our role is actually the communication of this complexity and the interconnectedness and advocacy. And what do we do to shift the perception of that hierarchy? And I took the liberty of adding that last bullet point and you could swap out the order of animals, humans, and the environment, I'm sure, but when we create a system that's good for animals, we create one that's good for humans and the environment as well. So really thinking about really thinking about the animal welfare piece as part of the larger environment, our health as humans, and the social injustices that really have been highlighted through this entire pandemic. When we create a system that's sustainable in one of those areas, it plays off and creates a system that's sustainable in all others. Does anyone else from the group want to add to that?
Doesn't look like it, although I do see in the chat box that the AgriFood sustainability and AgriFood systems also touched on that exact same topic. So it's interesting, we're having some intersecting ideas that are coming out through these different breakout rooms and these different ideas. Always great to see this kind of synergy between everything. So we're going to move on to climate change and mental health now.
Great, I think Jillian's gonna present for us.
For sure. Perfect. So we talked a lot about recognizing the ecological impacts of climate change on mental health and the outcomes that come out of that. And I think the first point we make is really around that mental health and some of the professions within it, we find ourselves often siloized and really stuck in the head, and that mental health is a result of personal struggles. But really, when we look at the impacts of climate impact on mental health, we really need to work outside of our silos and with other sectors that we aren't used to working with, and seeing creative solutions at multiple levels. And so we talked about public health working alongside with education, mental health stepping to working with occupations like forestry and mining and farming, and bringing them into conversations about how we can make change on all levels for climate change and how that can benefit and impact mental health and well-being. So we also talked about transitioning to a caring environment and a caring economy, and how COVID-19 really revealed the consequences of neglecting this sense of caring and the value we put on caring work. We talked about really the education on the impact of environmental consequences and the ecological impact of climate change from elementary upwards, and how public health can work with education systems for that. And we talked about the importance of having credible, trusted messengers to convey information, and how Bonnie Henry has done such a great job of this, and the impact that she has had on action within our province. And we talked about what's needed to bring about behavior change, and that is our kind of lasting next steps in our next question. Does anybody from my group have anything they want to add? Nope. All right. I will.
Okay, awesome. Thanks, guys. Yeah, everybody loves Dr. Bonnie Henry. She's been so awesome for the whole situation. It just makes everybody feel a lot more comfortable. So yeah, that's great. Let's move on to how should Canadian public health respond to the climate emergency?
We're kind of scrambling here because our note taker couldn't.
Oh, yes.
So wait, I think we have something, and Jade Yahia has it.
You know what? I'll go over and I'll do pollution and ecotoxicity, and I'll do you guys last. I'm totally forgot about that, and I completely understand. I know Haley's been talking to me about the connection issues, so really sorry about that, everybody in that group. Pollution and ecotoxicity, we'll head to you guys first.
And that's Chris.
All right, perfect.
Perfect. Okay, so we had a great conversation with Trevor. I think one of the main points that we really went over is how contaminated our food chain is, and the importance of, I guess, pressuring, AgriFoods to go about better practices and create healthy links and more healthy products. Certainly, as a citizen, you can go out and you can get better ideas about, make better choices for yourself and know what's going into your products and what's going into your food that you're eating. You need to certainly reduce exposure to all sorts of chemicals. We talked about the various cleaning products that are on the market that help reduce chemicals as well. As a professional, recognize the complexity of stress factors. Do cost-benefit analysis on whether it's worth pursuing a course of action and whether it affects the greater environment, whether it's going to be on the local level or the greater meta level. Is what you're about to do going to be worth it, and review your cost benefits as to what you're doing and how to improve those. Also teach others. We can create workshops and talk tables to share information and resources. That is, of course, really, quite important. Further to this, as an organization, work on proper, pardon me, work on proper modeling for stress factors. Consider healthcare factors, ally yourself with environmental movements, and as a public health community, raise awareness about conversations and how BIPOC communities are impacted. Does anybody else have anything else to share on that?
I'd just add that the point around healthcare factors was, is your healthcare organization a member of the Canadian Coalition for Green Healthcare? Is it purchasing ethically and behaving ethically? Because doing harm to the environment is actually a breach of the Hippocratic Oath.
Well, that's great. More great conversations came out of that group. So how should Canadian Public Health respond to the climate emergency? Are you guys ready yet? And once again, sorry about the connection issues that you guys were having.
I think we got it thanks to Jade's magnificent behind the scenes work. I'll just put up my screen here. There. So hopefully you can see that now.
Yeah.
So we think that public health is not adequately taking advantage of the credibility that we have, or maybe we just haven't grown into the role. Again, following on the outstanding example of Bonnie Henry's ability to communicate, connect the dots for people on the COVID-19 pandemic, similar communications are required for people to connect the dots on climate change, planetary health, and future pandemics. How do we do that in public health? We need to be able to integrate that with our other requirements. So it's not as if we're suddenly going to get 30 FTEs across the province or wherever your jurisdiction is, suddenly be working on climate change. It's going to be a matter of taking people's portfolios that they're already working and making the linkages to planetary health. We talked about how the smoking campaigns were able to do this, and it's actually a great analogy. If you think about all the different aspects of the smoking campaign, it used evidence-based fear. It used here after you recognize how bad things are for you, we're going to help you get out of it. Those sorts of methods are important. It can't just be fear, it has to also be hope. So we also talked about, how much convincing is needed. And we drew on the work of Erica Chenoweth about, well, actually, only 3.5% of the population in a sustained way can actually change, even change a government. So 3.5%, depending on your point of view, it's a lot or a little, but it's well documented to produce social change if you can sustain it. And that's achievable, and I think we've seen that with Black Lives Matter. Bouncing forward, not back. In energy policy, for example, incentivizing planetary protection, not planetary destruction. Follow the money. Where is the money going? There's lots of money going out the door. Where is it going? Who's benefiting? And is it destroying the planet or protecting the planet? In policy making, we have the economic capability to combat climate change, but we don't have the political will. And it's developing that political will that is a key role for public health. Folks, we talked about insurance, actually insuring the pipeline. We had quite a bit of talk about the Trans Mountain Pipeline expansion is the right fight at the right time and in the right place. There's another question of following the money. So just one more thing, drawing from the nuclear war prevention movement, it was noted that the way that movement succeeded, at least so far, we have prevented nuclear war, was to use a combination of evidence-based fear and hope. So that's a good way to help people connect the dots, scare them enough into action, but give them hope that it's not all doom and gloom. Thank you. Other folks?
Excellent. Sounds like another excellent conversation. This is